Good evening and welcome to another Praise 104.1 Heart to Heart panel discussion. My name is Ron Thompson. I'm the program director for Praise 104.1. You can tell your friends and family that they can follow us right now on our website, praisedc.com, our Facebook page, or YouTube. I'm excited about this conversation tonight because we're talking about the brand new University of Maryland Capital Regional Medical Center that's opening up on June the 12th. Now, I drive by this medical center every day on my way home. So I've seen it from the ground up, and it's looking very, very nice. This new hospital is part of the University of Maryland Capital's Change Up movement. Where are we changing up healthcare in Prince George's County and the surrounding area? The new medical center is designed with patient safety and patient experience at the forefront of all design and service entry elements. Level 2 trauma, Heart and Vascular Institute, dedicated women and infants floor, expanded surgical services, behavioral health, and more. They will continue to focus on health disparities in heart rate, women's health and domestic violence, and sexual assault. And are looking to expand services in cancer diagnosis and treatment. As the only level 2 trauma center in Prince George's County, the new medical center is uniquely equipped to meet the needs of the community and the surrounding areas. So tonight, I am pleased to be joined by Dr. Joseph Wright, Senior Vice President and Chief Medical Officer, Dr. Charles Fox, from the Heart and Vascular Institute, Dr. Stacy Little, Vice President of Women's Services, and Dr. Anthony Tanous, Medical Director of Trauma. Good evening, everyone.
Good evening.
Evening.
All right, so I'm excited. So I'm going to start right off with Dr. Joseph Wright. The first question I've got for you is, what can the community expect when coming to the new hospital?
Well, thank you, Ron. It's indeed a pleasure to be with you and your audience this evening, and I really want to acknowledge Praise 104.1 for having us. And I spent the day at the new facility today and taking some tours through. And as you mentioned, I too drive through the campus every day on my way to and from work, and we're really very excited about this new facility. It has been a long time coming. In fact, I will just share with the audience that the Memorandum of Understanding to build this building was signed on July 20th, 2011, so almost a decade ago in the making. And what I think the community can expect and it is a state-of-the-art 21st century facility. The technology, not only are we opening a new facility, but we're also launching a new electronic medical record. And this may sound like it's some inside pool here, Ron, but this will make life so much more efficient for the patients. It'll cut down on the inefficiencies that are experienced with paper records, and will really allow for a much more seamless experience as the public comes in to use the facility. As you mentioned, all of these services that we currently are responsible for in the county will port over to the new facility, as well as some enhanced services. And Dr. Fox and Dr. Tanous and Dr. Little will speak to those. But I think more than anything, Ron, I think the public will be not only impressed with the state-of-the-art edifice, but will be very much welcoming of the expanded services that will come with the University of Maryland Capital Region Medical Center. And I just want to, you made the point that this new facility is part of a larger health system, the University of Maryland Medical System. And Dr. Fox and Dr. Tanous are faculty members at the University of Maryland School of Medicine. and that they bring their expertise into our local armamentarium and expertise here on the ground in Prince George's County. So those are the major changes, Ron. Again, very excited for us to be here and having this conversation this evening.
Okay, Dr. Wright, and I'm jumping around a little bit, so I'm going to skip right to the vaccines. Why are vaccines important?
Yes, vaccines are important so that we can get back to a place of normalcy. Just simply stated, we're in a very precarious place right now. Our health system has been vaccinating in the community now for several months. We've vaccinated almost 70,000 Prince Georgians, and we're at a place now where almost 50% of adults have been vaccinated. We just started vaccinating teenagers 2.5 weeks ago, which is very important because as more and more adults have gotten vaccinated, the young people now become vulnerable. And until we can get to a place where this virus doesn't have a place to go, meaning doesn't have a place to spread in the community, we will still be vulnerable. So it's critically important, even as jurisdictions open up, and certainly people have experienced the opening up of restaurants and folks moving around as the summer looms. But we still need to be vigilant, and we still need to encourage those who have not been vaccinated to please get vaccinated. Critically important. Thank you for bringing that up early in our discussion.
Okay, in case you are just joining us, this is our Praise 104.1 Heart to Heart series. We are talking about the new medical center, the new University of Maryland Capital Regional Medical Center that's opening up on June the 12th. I'm Ron Thompson. Our panel includes Dr. Joseph Wright, Dr. Charles Fox, Dr. Stacy Little, and Dr. Anthony Tenos. Dr. Wright, why do you think Prince George's County was hit so hard?
Well, Ron, what the pandemic did was basically lay bare underlying health disparities and chronic disease challenges that the Prince Georgians have borne for a long time. And what we experienced over the last 1.5 years in our health system has just been a doubling down on the intensity of the impact of this pandemic on our community in a way that is unprecedented across the state. No question that Prince George's County and frankly our health system was the epicenter of the epicenter when it came to the impact of the virus. So again, I don't think that this was a terrible surprise, quite honestly. We recognize that the community and the population we care for, and Dr. Little can get a little bit more into that, certainly is replete with a number of chronic conditions, heart disease, diabetes, metabolic syndrome, all of which contribute to making all of us more vulnerable to something like the coronavirus 19 virus.
So, Dr. Wright, have you noticed a lot of vaccine hesitancy since you started vaccinating people in the community?
Ron, what I'd like to call it is building vaccine confidence. And that I will tell you that having since the 16th of December of 2020, having talked to hundreds, if not thousands of individuals, what I've learned is that everyone has their own reasoning, their own personal story, and it's important to really educate, really understand where folks are coming from. And I like to talk about it from the standpoint of building confidence through that education. Yes, indeed, certainly at the outset, there was a lot of hesitancy. But I'm really proud to say that here in the county, we have caught up because we provided access points. Our health system, for instance, has partnered with the First Baptist Church of Glenarden. And I think that combination of a faith-based location in the community with trusted individuals who are working there has really helped us push the numbers up.
Thank you. Dr. Charles Wright, Senior Vice President and Chief Medical Officer. We are talking about the new University of Maryland Capital Regional Medical Center. I'm going to turn my attention now to Dr. Charles Fox of Heart and Vascular Institute. What is the difference between a cardiac surgeon, I'm going to get this one wrong, thoracic surgeon, and a vascular surgeon?
Well, Ron, we're all very similar in that we're subspecialized surgeons to take care of the community that needs us to be good at what we do. But a cardiac surgeon specifically focuses on diseases of the heart and diseases of the heart valve. Vascular surgery, like myself, focuses on the pathology of peripheral vascular disease and helps my colleague, Dr. Tanous, deal with trauma patients that might have torn arteries of various things or requires us to stop bleeding. Thoracic surgeons deal primarily with cancer, cancer of the chest, specifically lung and esophageal cancers.
Okay, so if someone requires cardiovascular care, what can they expect from the Heart and Vascular Institute?
Well, Ron, our senior leaders deserve to be complimented for building a state-of-the-art center that's focused on specifically providing a good customer service and patient safety, something long in need. The citizens of Prince George's County have a significant disparity of peripheral artery disease, 4 times the incidence of PAD in the neighboring counties. And so we've created an institute to provide excellent care, and we have a state-of-the-art system that we're very proud of. We specifically want patients to feel comfortable coming to our facility and getting a quality care. We're delivering a sort of an academic quality with the partnership of the University of Maryland and responsiveness that people need. They need us to respond to their conditions quickly.
In case you've just joined us, we are taking part in another Praise 104.1 heart-to-heart town hall discussion. Tonight we're talking about the new University of Maryland Capital Regional Medical Center opening up on June the 2nd. Our panel includes Dr. Joseph Wright, Senior Vice President and Chief Medical Officer, Dr. Stacy Little, Vice President, Women's Services, Dr. Anthony Tanous, Medical Director of Trauma, and currently speaking, Dr. Charles Fox, Heart and Vascular Institute. Dr. Fox, what makes the care you provide stand out from others in the area?
Well, we think the others in the area are very good, but you know what we've created here with the partnership of the University of Maryland and the senior leadership is a trauma and vascular system where we have the ability through our partnerships to deliver the most appropriate care at the right place at the right time for the right patient. So we think that we're superior in the way that we manage our patients here at this state-of-the-art system, but we have the ability to transfer patients that need a higher level of care wherever that may be.
So another question I have for you, and this could be for any doctor, but I'm going to address it to you, Dr. Fox. What should people know to keep them out of the hospital?
Well, the key is wellness. What we do is we create long-term relationships with our patients so that we can provide wellness care to them, properly medically manage their peripheral artery disease in an outpatient setting so that they don't require emergency department admissions at the last minute. And one example of that would be the significant PAD population, peripheral artery disease population or dialysis access population in PG County. And we want to see those patients in our outpatient clinics in Bowie and Laurel and Largo so that we can take care of them before they require an emergency admission.
Dr. Charles Fox, Heart and Vascular Institute, thank you so much. We turn our attention now to Dr. Stacy Little, Vice President, Women's Enterprises. Good evening, Stacy. Are you there? Or are you muted?
Yes, I'm here.
Okay, great.
No, I'm not. I think you can hear me. Can you hear me?
Yes, we can hear you now. Dr. Little, what is the scope of women's health services offered at the University of Maryland Capital Regional Medical Center? Could you hear me? I'll ask the question again. What is the scope of women's health services offered at the University of Maryland Capital Regional Medical Center? Okay, we're having
Ron,
some
it
audio
appears,
problems.
Ron, it appears that Dr. Little's having some technical difficulty. So while we're straightening that out, let me just address that. Dr. Little and I worked very closely together in her role. We recognize that the importance of women's health broadly, not just reproductive health. We obviously are very committed to taking care of women of reproductive age and certainly participating in delivering healthy babies. But we also, like Dr. Fox mentioned, also believe strongly in women's wellness. So we have fielded a group of specialists, not only in obstetrics and gynecology, but also in a range of specialties that support women's wellness. For instance, one of our specialists, one of our cardiologists, in fact, is focused on preventive cardiology, specifically focused around women. We have a urogynecologist who focuses on the problems of mature women after childbirth and dealing with those problems. We're also developing a bariatric program to deal with weight loss, and one of our plastic surgeons supports that program in terms of the cosmetic needs in that area. So a number of our specialists are focused around women's wellness, not just around reproductive health, but in women's wellness broadly. And this is the work that Dr. Little and her team is leading. And again, this represents an expansion, Ron, of what we're going to be doing at the Capital Region Medical Center, and more broadly across Capital Region Health, because it's broader than just those 205 beds at the hospital. These specialists are positioned throughout the community in their offices, and we're very excited about bringing that to bear to the community as well.
Okay, in case you've just joined us, this is the Praise 104.1 Heart to Heart Town Hall Series, how the University of Maryland Capital Regional Health is changing up healthcare in Prince George's County. You just heard from Dr. Joseph Wright, Senior Vice President and Chief Medical Officer. We'll try Dr. Stacy Little again, Vice President of Women's Services. Dr. Little, can you talk about any specific programs and outreach efforts underway to inform women about the importance of such topics as prenatal care? Did you hear the question? Okay, apparently Dr. Little has some issues with that. We'll circle back to Dr. Little. Let's move over to Dr. Anthony Tenus, Medical Director of Trauma. Dr. Tenus, what is a Level 2 trauma center? I believe you're muted.
How about now?
Oh, great.
Perfect. Thank you, Ron. Thank you for the opportunity to be on this panel and for the opportunity to talk about our new and exciting medical center. We've been eagerly awaiting the move. So to answer your question, the state of Maryland looks at every trauma center and evaluates and reviews its resources and gives it a designation. A trauma center can be either level 1, level 2, or level 3. Level 1 is the highest level with the most amount of resources. Level 3 is the lowest level with the least amount of resources. We are a level 2 trauma center. We are the second busiest trauma center in the state of Maryland. We are busier than other level 1 trauma centers in the state. We do lack some of the higher specialization resources, and that is why we are not a level 1. But we see about 3,200 patients a year. We're the second busiest after the University of Maryland in Baltimore. And we are working every day on increasing our resources. Our goal and our mission is to transfer as few patients as possible and to provide comprehensive care at the Prince George Hospital Center, University of Maryland Capital Region Health. And we are achieving that more and more every day. We transfer less than 5% of our patients, and we're very proud of that.
Okay, Dr. Tenus, what are your survival rates?
Our survival rate is about 96%. The national average is about 94%, so we are doing well with that. We have a higher rate of penetrating trauma than the national average. And I say that because usually that type of trauma, and when I say penetrating trauma, I mean trauma secondary to gunshot wound or stab wounds or other that sort of injury. Usually the survival rate is lower, but we are able to maintain a pretty low mortality rate and a high survival rate. Our goal is 100%, but we work towards that every day.
Okay, in case you've just joined us, this is the Praise 104.1 heart-to-heart town hall discussion. We are talking about the new University of Maryland Capital Regional Medical Center. It's scheduled to open up on June the 12th, just a few days away. I know everyone here is excited about it. I can't wait as I pass by it every day. Our panel includes Dr. Joseph Wright. He's the Senior Vice President and Chief Medical Officer. We've got Dr. Charles Fox, Heart and Vascular Institute, and we are working to get Dr. Stacy Little back on, Vice President of Women's Services. And currently, we are talking with Dr. Anthony Tenus, Medical Director of Trauma. So, Dr. Tenus, what are the most prevalent, types of trauma cases that you see?
Our three most common mechanism of injury are falls, motor vehicle collisions, and penetrating trauma injury secondary to gunshot wounds and stab wounds. The national average for that type of trauma is around 15%. 20% of our trauma is from these types of penetrating injuries. And we definitely are equipping ourselves as best as possible to take care of these patients as they come through the door.
Okay, I want to also inform our listeners that they can also ask questions online via our website, praisedc.com, our Facebook page, or YouTube. We have some specialists here, and if you have any questions, feel free to send them in, and we'll see them right here, and we'll be able to address them. Dr. Tenus, I've heard the term herd immunity, but what does that mean, and how close to we are achieving it?
I think I'll go ahead and take that one, Ron. I want to brag on. I want to brag though. Before I answer the question, I want to brag a little bit about the Dr. Tenus's trauma operation. I again spent the day at the new Regional Medical Center, and what Dr. Tenus and his team have been able to accomplish without the kind of efficiency that will be experienced in a new building is remarkable. What I think, we never wish for anybody to have to meet Dr. Tenus in the trauma center, but I will say that the ability to quickly get to the expertise of Dr. Tenus and his team in the trauma resuscitation unit, and then if there is an operation that's necessary, it is literally the OR is just steps away. And this is such a remarkable upgrade from what we're dealing with today. Also, for those patients who have to be medevaced by helicopter as a trauma patient, there is a dedicated elevator directly from the rooftop, directly to Dr. Tanusa's team. These time-saving steps and efficiency is what was baked into the opportunity when you build something from the ground up. And I just want to make sure this is not a renovation. This is not an addition. I've been a part of that. I'm sure Dr. Fox and Dr. Tanus in their careers have. But to have a facility from the ground up where you can think about what is going to be in the best interest of the patient as you design it is something I just want to brag about. And no more efficient operation than what was designed for the trauma team. So herd immunity. So herd immunity simply means, Ron, that we have vaccinated enough individuals in the population such that community spread is eliminated. In other words, there are few enough people who are not vaccinated or vulnerable to the virus such that there's no place for the virus to go. We're not there yet. Herd immunity is generally achieved somewhere in the 75 to 80% range of people being vaccinated. As I mentioned, 50% of adults in the country, that's going to be more than 150 million people are fully vaccinated, but we still have a ways to go to achieve full herd immunity. Herd immunity protects all of us. So again, just to tie back to your earlier question, we still need to get people vaccinated in order to get to that place of herd immunity.
Okay, I do believe that we have Dr. Stacy Little, Vice President of Women's Services, back with us. Can you hear me now, Dr. Little? She might be muted. Can you hear me now, Dr. Little? Okay, seems like we still don't have her. So let me just ask this question of the panel. Oh, you can hear me. Okay, great. So, Dr. Little, we were talking about the vast women's services provided.
Yes.
And my question to you, do you have any specific programs and outreach efforts underway to inform women about the importance of such topics as prenatal care?
Absolutely. We have several programs in the county. Specifically, we have a supportive pregnancy care program that is funded through the March of Dimes. We work with community-based partners to involve and engage women who otherwise would likely enter into prenatal care late or delayed for a multitude of reasons. And we make sure that those women get into a prenatal care program that is led by midwives, and it also allows and encourages a peer support model that has been found to be very, very effective among women who are high risk for gestational diseases such as diabetes or hypertension during pregnancy. So we see this as an opportunity to really engage high-risk women early, making sure that they get the prenatal care they need in an environment that is inviting and supportive and is informative, because again, it's led by professional and advanced practitioners.
Okay.
We also have through our prenatal care program we have through our medical group, our providers focus on preconception care. Our providers focus on preconception care as well as prenatal care. So the importance of having a healthy baby is that, as Dr. Fox said, is prevention, is making sure you're your healthiest you before you become pregnant. And so that's talking to women before pregnancy, preconceptionally, and as they think about and plan pregnancy, making sure we're talking about nutrition, making sure that we're talking about how they want to become pregnant, when they want to become pregnant, when it's most optimal for them, so that it's planned, it's something that they are expecting, and that they are their healthiest self when they become pregnant.
Okay, we are talking to Dr. Stacy Little, Vice President of Women's Services and the new University of Maryland Capital Regional Medical Center, scheduled to open up on June the 12th. And I just want to ask this question, and this could be for everyone, but I'll start with you, Dr. Stacy Little. What makes this new medical center stand out from all the others that are in the area? Because I think the residents of Prince George's County, they've got a gem right here that's going up just literally down the street from me. So I'll let you talk a little bit about that. Dr. Little, did you hear my question? I believe her screen is frozen. All right, so I'll throw this question out to Dr. Joseph Wright first. What makes this new medical center stand out more so than any that are in this area?
Well, Ron, let me just say, as a 30-year resident of Prince George's County, and this medical center is right down the street from me as well, I'm excited because it brings the kinds of services, the kinds of expertise, and the kind of technology that brings care to our residents into the 21st century and looking ahead. And the county has long deserved this kind of facility. And as Dr. Fox mentioned, it's not that we are comparing ourselves to other programs or other facilities. Other health systems also serve the county and do a fine job. What we're excited about is what we're bringing to bear is particularly in terms of the expertise, the alignment with the University of Maryland. This is by the way, the first foray of the University of Maryland medical system into our market. Typically, the University of Maryland medical system has been primarily based out of Baltimore and in other parts of the state, and bringing the expertise of clinicians, expert clinicians like Dr. Tanoush, like Dr. Fox, and a host of other physicians to bear is very exciting. That is novel, and I think as the public begins to get to know these individuals and meet these experts, I think they will see directly and personally the great advantage that we have in standing up this new facility.
Okay, I will ask the same question right now of Dr. Charles Fox.
Well, I think Dr. Wright really summed it up very well. You know, we've responded to the needs of the Prince George's County citizens who have really indicated the disparity of their disease processes and the need for, a very advanced medical system in the area. And we're very proud of it. I personally really enjoy working with Tony and Dr. Wright, and we enjoy going down there and taking care of the people. And, there's a certain amount of camaraderie that I think is developing over time, and it's palpable. We really enjoy the patient population. We like being an academic institution, and we're very proud of the fact that, we've all been very well trained, but we've decided to make our home in the PG area. And I think that the citizens are going to see a reflection of our enthusiasm. We have a state-of-the-art medical facility there that when people walk in, they're going to feel very proud to be there. And one of the things that I'm very proud of is the fact that my partners are really state-of-the-art. And I think that this momentum is just going to gain a lot of traction over the next couple of months.
Thank you so much. Dr. Anthony Tanoush, can you speak about the upgrade or the quality of the new facility?
So I'm going to echo what Dr. Wright and Dr. Fox said in saying that we are very proud in our mission, and we are very committed to serving the patient population of Prince George's County and the area. We feel the responsibility of being the only trauma center in this region, in our region, of serving that volume of patient. And we have thought out every detail a million times to make sure that we are rendering the care as efficient as possible, from the time it takes from the helipad to the trauma bay to the operating room, from the presence of blood and plasma in the trauma bay so that we don't delay any blood transfusion, from our mechanisms of calling consultants. We're trying to reduce the time between injury and treatment to optimize our care. We've also worked hard on optimizing our intensive care unit and our care in the intensive care unit, and on working on partnerships with consultant teams and with other hospitals that can provide us with support. So we're trying our best every day to optimize the care we offer to the trauma patient, because we believe that the trauma patient, really any patient, but as far as I'm concerned, the trauma patient deserve the best care that is available. And we're very proud of this mission, and we always talk about the mission in our group, and you can only work with us if you're part of the mission. So we are very, very proud of that.
And Ron, before we move on, yes, the trauma care is just one of the time critical services that we provide for those patients who are having a heart attack. We are a cardiac intervention center where we can bring the patient directly to our catheterization lab and work to stop that heart attack as it's happening. We're also a primary stroke center where if someone's having a stroke, we can directly get that patient imaged and administer the medication to bust that clot that's causing the stroke. These are the kinds of services that are so vital for Prince George's County because of the, as both Dr. Fox and Dr. New said, because of the disparities that we experience with patients presenting in this kind of extremis. So I would be remiss if I didn't mention those two conditions, which are services that we'll be bringing over from where we are presently to June 12th at the new facility as well.
Okay, ladies and gentlemen, this is the Praise 104.1 Heart to Heart Town Hall. We are talking tonight about the new University of Maryland Capital Regional Medical Center, scheduled to open up in just days from now, June the 12th. And my question is about patients with COVID-19 and how will the new hospital be able to deal with them and moving forward as we try to open up, going maskless and returning to some sense of normalcy?
Well, Ron, I'll answer this one with a great deal of pride. We have been, as I mentioned, at the center in the crucible of the COVID-19 pandemic here in the state of Maryland. So we have a lot of experience. And one thing that the new facility allows us to do as a totally private bed hospital is that we can isolate those patients, any patient with an infectious disease like COVID-19. We also have state-of-the-art negative pressure rooms where we can protect the rest of the patients and the rest of the facility from having spread. And this is a technological upgrade for us. I will say it's ironic that this question is asked today. This is the first day that I can remember since the pandemic began a year and a half ago, almost a year and a half ago, that we have had zero COVID-19 patients in the hospital. That's a remarkable milestone. But we are prepared. We are certainly prepared at the new facility with the upgrades with our infrastructure and the technology to handle any COVID-19 patients that should require admission to the hospital.
Ladies and gentlemen, in case you just joined us, that was Dr. Charles Wright, Senior Vice President and Chief Medical Officer. We're talking about the new University of Maryland Capital Regional Medical Center, opening up on June the 12th. Other members of the panel include Dr. Anthony Tenos. Dr. Stacy Little is going to be joining us again momentarily, and of course, Dr. Charles Fox, Heart and Vascular Institute. Dr. Fox, I want you to talk about for a second the rate of African Americans with heart and vascular issues. What is your opinion about it? How much of it is related to our diet? How much of it is hereditary? And what can we do to change that rate?
It's a good question, Ron. It's disturbingly high, and it's probably at least 4 times the prevalence of the neighboring counties. We think that it's primarily genetic, but certainly diet and other behavioral modifying factors account for this, including cigarette smoking, diabetes, end-stage renal disease, and hypertension are all very prevalent amongst the local population. So we think that, these things require a lot of preventive health care. Our primary care division is very strong and makes appropriate referrals. We want to focus on the dialysis patient population specifically and those with peripheral artery disease, having them see their primary care doctors and be patched in with podiatry and vascular surgery as early as possible.
Okay, I think we have Dr. Stacy Little back with us, Vice President of Women's Services. Dr. Little, what would you say is the most important issue facing women's health, and how will the new facility be able to assist in helping them? Okay, I think did you hear the question? I think we're having an issue.
Yeah, one of the things I'm struck by in working with Dr. Little and her team is that the women of childbearing age, and I'll reference the head of our maternal fetal medicine program, that 50% of the women, the young women that deliver here in our practice and in Prince George's County writ large have a comorbidity. In other words, have another problem going on. That's an extremely high number. And what Dr. Little and her team are doing is to really try to get ahead of that complication. For instance, if there is hypertension during the pregnancy, making sure that that young woman has an appropriate referral to the Heart and Vascular Institute to follow up on the potential complications of that hypertension that was diagnosed during the pregnancy. And this is when Dr. Fox talks about making sure that we have appropriate referrals to our primary care providers, in this case to a preventive cardiologist who can support that woman, is exactly the work that Dr. Little and the Women's Health Program is all about. It's really, I call it getting upstream before the problems really find us in the deep water.
Okay, this COVID-19 season has forced us all to work in a way in which we've never worked before. I mean, we're doing our jobs, virtually. Talk to me about how this new virtual reality has changed the way you guys deal with patients and getting the message out to patients, and if you can, just talk about what the outreach program is going to look like once the hospital opens.
Yeah, unfortunately, well, we've all been at work every day. We don't have the luxury of being able to do what we do remotely. But one residual benefit that has emerged from the pandemic has been the use of telemedicine. We have leveraged the technology of being able to communicate with patients remotely, both in the hospital and outside the hospital. And that's something that we are certainly baking into our practice, and certainly I believe is going to follow us. I'll defer to Dr. Fox in particular about staying connected with patients in the outpatient arena through the use of telemedicine. But the pandemic was an accelerant to the use of that technology in staying in touch with patients.
Well, thanks, Dr. Wright. I think, I agree. The technology that we've leveraged has been in our favor. In vascular disease, a lot of times it's a matter of seeing the wound and understanding the gravity of the situation as to whether the patient can be managed as an outpatient or whether they need to come into the emergency department and be admitted. And many times in vascular surgery, it's the imaging that counts. So the decision to send the patient for further imaging based on a telemedicine consult is so valuable. The other thing it's done is it allowed us as providers to really communicate a lot better. There's very few conferences that I am able to miss anymore as a result of being able to get on a Zoom interview and really discuss with my colleagues the important aspects of the conference at hand. So it's been an educational process all around.
Dr. Anthony Temus, you want to field that question?
Like Dr. Wright mentioned, it's hard to really do our job without showing up to work every day. So we have been going to work every day, but we have, in addition to all the things that were mentioned with telemedicine and the conferences, we've learned how adaptable we are. So, we in trauma believe that the trauma patient, we have to follow them longitudinally. It starts with prevention, and after they are released from the hospital, we provide them with a supportive network because we want to reduce recidivism. And we have a pretty robust violence intervention program that is based on in-person meetings and support group after the patients are discharged from the hospital. It's a very robust for Capital Region Health. And because we needed to adapt with the pandemic, we moved to virtual meetings, and we kept on meeting with our patients every week. New issues were arising. With the rise of unemployment and financial issues, people had new issues to bring to the table, and we kept on meeting with them through Zoom, and we actually increased attendance because it was easier to connect. So we've learned that we can adapt to the situation. We can continue to keep touch with our patients, and we cannot wait to meet everyone again in person, which is why we're thrilled that the numbers are going down and that people are getting vaccinated. But I think the pandemic taught us that if there's a will, there's a way. So we kept on going.
In case you've just joined us, this is a Praise 104.1 heart-to-heart town hall discussion on the new University of Maryland Capital Regional Medical Center opening up on June the 12th. It's part of the University of Maryland Capital Regional Health, changing up healthcare in Prince George's County by expanding access, addressing its health disparities, and providing state-of-the-art care in residents' backyard. And I can't emphasize that more because I literally ride by it every day, and I keep saying that because it wasn't there not so long ago, and now you can actually see what is possible. And I think that part has me excited because it's so accessible. So I want to go back to Dr. Charles Fox of the Heart and Vascular Institute. You mentioned before that a lot of the issues that African Americans suffer is part hereditary and part diet. Um, do you offer any assistance with nutrition as it relates to these injuries, these illnesses?
Yeah, well, thank you, Ron. That's an important aspect of their overall health. And we certainly have a strong dietary service. So when we see patients in the hospital, we usually get a dietary consultation in addition to physical therapy, occupational therapy, and other things to really rehabilitate people, sort of change up their lifestyle, encourage smoking cessation, and provide them opportunities through their primary care provider to stop smoking, change diet, supervise exercise programs, cardiac rehab, all of the things that really keep them out of the hospital and get them back on a wellness regimen for life.
So let me ask you, Dr. Fox, smoking versus the artificial smoking, the vapes. What's your opinion on that?
Well, vape is sort of new since I went to medical school, so I don't know what the active literature is on the area, but I think, nicotine in general is a vasoconstrictant. And so when we deal with wounds, particularly on the foot, as a vascular surgeon, we're very concerned about, delivering better oxygen to those tissues. So anything that's constricting the blood vessels is a threat and could possibly result in amputation. So we're generally encouraging people to just withhold from those behaviors. It's the single one thing that people can do to prevent amputation. And then we focus on the other things.
Okay, we got about maybe 9 more minutes to our town hall. We are talking about the University of Maryland Capital Regional Medical Center that's opening up on June the 12th. And our panel has been outstanding. Dr. Joseph Wright, Senior Vice President and Chief Medical Officer, Dr. Charles Fox of Heart and Vascular Institute. We've had Dr. Stacy Little on, the Vice President of Women's Services, and Dr. Anthony Tenus, Medical Director of Trauma. I'd like to give you all just a few minutes before we close, just to just kind of give your final remarks and what you want the community to expect from the new facility.
Well, Ron, if I might, there's a question in the chat which I think will answer one of the questions that I've heard repeatedly in the community. The efficiency of our new emergency department will improve. We have an area, a fast track area, that will be able to quickly move patients who are who we call vertical patients. They're upright. They're not the kinds of patients that Dr. Tenus is treating in the trauma unit, that we can quickly treat and street, as we say in the parlance. As a emergency medicine is my background, so I don't mean to use the pejorative there, but we really look forward to leveraging that fast track area so that folks aren't languishing in the waiting room. We can get them back quickly, assess what's going on, take care of it, and get them out and back home. So this is going to be a tremendous advantage in terms of the emergency room that we currently are not able to accomplish here at the old facility. So that's I think that'll be a community satisfier, not having to hang out for hours in the waiting room.
And can I also ask you about infant care? How will the facility be able to handle, infant care in the county?
Yeah, we have a nursery, a special care nursery that can treat premature infants. We also have a maternal fetal medicine program, which takes care of women with high-risk pregnancies, so that if we know that there is going to be a preterm delivery, we're prepared to take care of that. Again, something that we want to really encourage women of childbearing age to use us. Come see the facility. Come see the options we have in terms of delivery. And that's another upgrade. We didn't talk about it tonight as much with Dr. Little having some technical problems, but please, I encourage all of the women who are thinking of having a baby or just coming through to take a look, take a visit. Please come take a look and see. I think you'll be impressed.
Okay, Dr. Charles Fox.
We want the citizens of Prince George's County to know that if they need us, they can depend on us to be good at what we do and take care of them. That we have the backing of our leaders and our partners at the University of Maryland, and I feel very well supported to do that.
Okay, like I said, once again, this has been the Praise 104.1 Heart to Heart Town Hall series. This particular town hall was on the new University of Maryland Capital Regional Medical Center, opening up on June the 12th, all part of the University of Maryland Capital Regional Health, changing up healthcare in Prince George's County. And some of the notes that we covered: the new medical center is designed for patient safety, patient experience at the foremost of all the design, service delivery elements, level 2 trauma, Heart and Vascular Institute, dedicated women's and infant floor, expanded surgical services, behavioral health, and more. We didn't really talk a whole lot about behavioral health, but in the closing moments, Dr. Joseph Wright, do you want to speak about that?
Yes, critically important service for us, and proud to say again, we're one of the few facilities in the county that has inpatient behavioral health. We also have a very robust outpatient behavioral health service that we will be bringing over with us. And again, just want the community to know that that service is available as well.
Okay, great. This has been great. Dr. Anthony Tenos, just before we sign off, anything you want to add about the new facility?
Well, I never wish on anyone to really come and meet me in the hospital, but what we are committed to is that in case you do need to come and meet us in the hospital, we are going to do our best to make sure that people get the treatment that they need as quickly as they need it, and that they get it fully at our hospital. And I think this new center really allows us to do this in a way that we have not done before. We're very excited to start working there, and you can feel the excitement in the air really in the hospital right now. We can't wait to move and start taking care of patients there. And we hope that we can live up to the promise that we're making.
I'm sure you will. That is Dr. Anthony Tenos, Medical Director of Trauma. Also tonight was Dr. Stacy Little, although we had some issues, Vice President of Women's Services. Dr. Charles Fox, Heart and Vascular Institute. And of course, Dr. Joseph Wright, Senior Vice President and Chief Medical Officer. I certainly appreciate all of you taking part in this heart-to-heart town hall discussion. I'm excited about it. I can't wait to visit you, not in the hospital, but to visit you in the hospital. Okay. This has been a Praise 104.1 heart-to-heart town hall discussion. We thank you all and have a good night.